This is really a frightening time.
The coronavirus outbreak spreading around the world.
We'll probably see more cases here.
The most vulnerable patients are dying. Businesses are being hit hard. Trips are being canceled as experts around the globe work to get it under control.
It is no time to panic, but it is time to be prepared.
Dr. Mike's in the house to answer all of your questions about the biggest headline around the world. COVID-19 has some living in fear, preparing for the worst. Others are just plain skeptical. We're going to help clear up some of the coronavirus confusion tonight. I'm Shayna Humphreys.
And I'm Jason Martinez. Every day something new develops, and here's where things stand tonight. 2 people are now being tested for the virus in Philadelphia. 8 are being investigated in Trenton, and New Jersey confirms it has 2 presumptive positive cases there. This as the world works to contain the outbreak.
This epidemic is a threat for every country, rich and poor.
The World Health Organization calling on global governments to pull out all the stops against the coronavirus. In the U.S., the death of a 71-year-old man who recently traveled aboard the Grand Princess has prompted California officials to fly test kits to the cruise ship out at sea.
While the vast majority of cases of COVID-19 worldwide have been mild, older persons and persons with underlying medical conditions are at increased risk of serious disease.
The case marks the first U.S. coronavirus death outside Washington state, where COVID-19 has already claimed 11 lives. Most of the fatalities involve residents of the Life Care Center nursing home in the Seattle area. Facebook has temporarily closed one of its offices after one employee tested positive, and Microsoft is advising all employees to work from home until March 25th.
We're encouraging employers to maximize telecommuting.
New York City reported 2 new cases, a man in his 40s and a woman in her 80s with no travel to high-risk countries and no connection to the other confirmed cases in the city. Tennessee announced its first coronavirus case, a man who recently returned from travel outside the state.
He is currently isolated at home with mild symptoms. His household contacts are quarantined. They're at home and are in the process of being monitored and evaluated for COVID-19.
And so here we are to tonight. Dr. Mike Sirigliano joins us now, and let's start with the questioning, Dr. Mike. A first question that a lot of people at home are thinking. The media is blowing this out of proportion. This is not a big deal. That's one school of thought. The other school is people going out there buying antibacterial hand gel. And so what's the truth here?
A little of both. I think that panic, there's no room or reason for panic, but we are in, and I'm going to say it, we're in a pandemic. A pandemic means that it is across the world, and that's what you're seeing. This is not hype. This is not to get ratings. The bottom line, folks, is that according to some estimates, up to 40 to 70% of people on the planet will get this virus. The good news is, for the vast majority that are healthy, not a big deal. But those who have underlying medical conditions, lung problems, are going to be at risk for having serious complications.
Okay, so Dr. Mike, explain why those people who aren't in the high-risk populations, those healthy people who will be just fine, why should they still care and take care not to contract the virus?
Well, if you have loved ones, Shanna, that you care about, you have a grandmom somewhere or a grandfather that's got underlying problems. Maybe they smoked. Maybe they have lung problems. Maybe they're on medicines to decrease their immune system. They're the ones we're worried about, and you need to worry about them because you can infect them if you get it and you're careless with hand washing and making sure that you control what you're doing in terms of this virus.
All right, send us your questions. Continue to send them. Dr. Mike will be here through the next half hour at least, and we will be talking to him and answering those questions a little bit more. And of course, he just mentioned this, and one way to prevent this is by washing your hands.
And doing it the right way. That's how simple it could be. But for some people, it's not that simple. Here's Chris O'Connell.
Do you know how to properly wash your hands?
I believe I do, yes.
It may seem easy. After all, how hard is it to wash your hands?
It's 20 seconds, right?
The best way to do it is to make sure that you're actually washing this way.
5 minutes, I think.
5 minutes?
Too long? I thought I saw it.
I got stuff to do. Actually, experts say we've been doing it all wrong.
People don't do it. You frequently leave the bathroom and I see people don't wash their hands at all, maybe wet them, maybe just use paper towel.
Nothing grosses Heather Murphy out more than someone not washing their hands. The Temple University professor of public health literally teaches hand washing to developing countries around the world. The biggest mistakes?
I think that's where people go wrong. They don't do it often enough, at the right times, and then probably not long enough.
She says hand washing is the single best way to prevent the coronavirus, or any virus for that matter. She gave us the dirt on getting our hands surgical clean.
First, you need to wet your hands, and then you add soap, and then you scrub your hands. You do your palms first, and then in between the fingers, and then the backs of your hands.
And when you think you're done, keep scrubbing. At the very minimum, 20 seconds, the amount of time it takes you to sing happy birthday twice. And once you rinse, use a paper towel to turn off the water to prevent contamination. Even her 7-year-old son, Oscar, knows the correct way, and he hasn't gotten the flu yet.
Well, I think we need to start with kids. They're the easiest to teach. So if you look at hand washing, you start with children. Children are great at bringing messages home to parents.
And remember, there is no substitute for good old soap and water. But if you're in a pinch, then definitely use that hand sanitizer.
Yeah, as a plan B, it makes sense. Yeah, and here's some food for thought as well. Experts say one of the most overlooked times to wash your hands when you first arrive to work. You're bringing all those germs either from the L, maybe you were taking the L, or
doorknobs,
Uber,
the elevator,
whatever.
everything.
Don't bring it into your workplace.
The battle against the coronavirus is getting some help. Schools are trying to make sure kids don't get sick. So they've brought in the big guns for a big job. And let's get back to Dr. Mike with our questions. Dr. Mike, I think a lot of people are canceling trips, wondering how far in the future they need to continue canceling trips. How long are we going to be dealing with this?
Well, we've heard comments about, well, when the weather gets warm, it's going to go away. It's not going to go away. I think it will be around into the fall. Remember that the world, when we get into our summer, the southern hemisphere is going to be winter. So the bottom line is, with a pandemic, you're going to see this go on for a while. I'm hopeful that down the road in the fall, we will have treatments and hopefully some form of a immunization program to prevent this from going on.
And there's no timetable on that immunization. But by the way, Dr. Mack, I see you got some supplies there with you. What should people be stocking up on? I mean, I know people are getting waters and they're preparing for a snowstorm.
It's like a
this is
doomsday event.
That's not what this is it?
Well, no. In fact, I'm worried about two things. I'm worried about the virus, and I'm also worried about the response of people, because I was born and raised in Philly, and you get a half an inch of snow, and you can't get milk and bread because it's not going to thaw out until May. So, folks, it's not going to be like that. What I would say is that you need to make sure that you have soap around and you wash your hands. And look, if you watch Good Day tomorrow morning, we're going to show you how to make some hand sanitizer from stuff that you can still buy, because to get this, you have to go on eBay for like $100.
Yeah, so
and you don't want to do that.
Now, we know you can't make it from Tito's vodka.
Yeah, don't
they were
use
very
vodka.
clear about that tonight.
Yes,
Just drink it.
Right.
Thank you very much, Dr. Mike. And here's a question. What do you do if someone in your home comes down with the virus? Step 1, have a plan. Well, here's a scary thought. Someone in your home comes down with coronavirus.
If that happened, would you know what to do next? If not, it's time to make a plan.
When you do a snowstorm, what do? You run out, you get the bread, the toilet paper, the eggs, you make French toast when the snowstorm comes. Here's another storm.
It may not be a snowstorm, but it is something experts say you should be preparing for: coronavirus. So what's your plan?
I use Clorox wipes all the time. And I also have a glove.
The CDC says you too should have a plan at home if someone around you comes down with the virus, like planning to care for those at the greatest risk, choose a quarantine room and separate bathrooms in the house for those who are sick, and plan for possible school closures or early dismissal. And you should identify organizations that you may need in case of a local outbreak.
It's going to sound a little weird. I asked the doctor for some antibiotics, and because I feel that they're going to eventually run out of stock at the pharmacy.
From school districts to hospitals to businesses, sending out warnings and announcing their protection plans in emails and websites. Signs like the one here at Fox 29 can be found in offices all over. If your workplace doesn't have a plan, ask about it. The CDC says employers should encourage sick employees to stay home, emphasize respiratory etiquette and hand washing, and make sure you disinfect your workspace. If you commute, we saw crews at Suburban Station wiping down walls and handrails, and New Jersey Transit tells us it's disinfected buses and trains daily. Over at the Philadelphia Flower Show, you'll see an increased number of hand sanitizing stations and hourly cleaning of bathrooms. Most visitors say they came prepared.
I knew coming into here, all the viruses that are out there now, but I'm just cautious.
All right, let's get back over to Dr. Mike now. We've been talking a lot about self-quarantine. We keep hearing thousands and thousands more people are being told to self-quarantine. Dr. Mike, what does that really entail? Let's say you don't have a plan. Your house is empty, your cupboards, your fridge is empty. What do you do?
Well, you want to isolate from other members of the family. So you want to pick a room like you just heard. If you do that, you want to have your separate bathroom, have your separate towels, and have someone, if you're alone and you don't have any food, you're going to have to get somebody to bring it to you. Maybe leave it on the floor, you get it, and that way you'll be able to hopefully prevent other family members from getting it.
Just Netflix and chill until you feel better.
Not time to get all the delivery services necessarily.
All right. So we have another question here about somebody who's got allergies and asthma, a respiratory type of illness. They're worried that if they did happen to catch COVID-19, how would they know the difference? Because sometimes with this condition, they get a fever too, and so how do you tell the difference, if you already have some kind of minor respiratory issue?
Boy, this is going to be the challenge of the century because we struggle now trying to tell whether it's bacterial or viral. So what we're going to have to do is listen to the patient carefully, examine the patient if they have an underlying condition. And one thing that many people don't know, the CAT scan may be very important in diagnosing people because the characteristic look of the coronavirus on CAT scan shows this peripheral areas of consolidation that is not typically seen. But if you have a history of asthma or lung problems and you have a fever in this time of life right now, in this era, you call your healthcare provider.
Okay, Dr. Mike, we have a question from Twitter. How long does one have it if they catch it, and how would they know they don't have it anymore? At what point do you stop being contagious?
Yeah. Well, we're thinking approximately 14 days. That's what we do as far as quarantine. But the bottom line is that some people may start to feel better sooner, and these are rapidly changing. I was just talking to one of our infectious disease experts at the University of Pennsylvania, and that might change. Bottom line is you don't want to get back to work too soon. And no employer, unless they're living under a rock, is going to say, oh, you just got over the coronavirus. Make sure you get in right away.
That's
not
true.
going to happen.
Makes a lot of sense why Microsoft told their employees to stay home until March 25th, trying to wait that period out.
And by the way, the next time we talk to you, I want to talk about how you said don't just show up at your doctor's office if you think you have it. There might be another way you can get treatment, correct?
Absolutely. Right. We're calling it telemedicine.
All right. We'll talk to you in a little bit about that.
A school district in Delaware is turning to a wand to help disinfect its classrooms.
And Fox 29's Marcus Espinoza has more on this germs guns magic touch.
It was pretty quick, and I could tell a difference as soon as I walked in here.
Meet the Protexis wand. It's holding nothing back when it comes to the elimination of germs that can fill up a classroom.
The Protexis uses a mist that is puts an electrostatic charge on that mist, and then when that mist comes in contact with a surface, it's attracted to that surface and wraps itself around that surface to be able to disinfect the entire surface.
The device uses tablets that dissolve quickly in water to form a sanitizing solution that's safe to use on food surfaces and does not require that it be rinsed. One tablet gives up to 800 square feet of sanitizing coverage. The devices were purchased last July for around $700 a piece, well before the most recent coronavirus outbreak. It's turning out to be a fortuitous decision.
We know with other coronaviruses, other strands, it is effective. They haven't come out and said, yes, this is definitely effective on this strand, but we're confident that, with being effective on past strands, that it will definitely help out if the virus does make it to this area.
For 5th grade elementary teacher Kimberly Mancini, she says her students do a great job practicing good health habits.
This time of year, especially with tissues, hand sanitizer, especially if soap isn't available, when you have to sneeze or cough, doing it into your elbow.
Overall, Ted Lambert, supervisor of facilities with Colonial School District, says it's already had an impact.
We feel that there have increased attendance numbers throughout these schools. That's one thing, it's a positive thing.
In Newcastle, Marcus Espinoza, Fox 29 News.